All right, let's talk about your pharmacist. Today, we're going to lift the curtain on that pharmacy counter and show you the secret roadmap that you use every single time you ask for help. It's a system that's been built from scratch specifically to keep you safe. Let's dive in. You know the feeling, we've all been there, right? You're just staring at this massive wall of medicine boxes. They're all promising relief for your cough or your cold, and it is so confusing. It's easy to just grab the one with the shiniest package. But your pharmacist, they're looking at that exact same situation and seeing something completely different.
You see, the entire world of pharmacy has done a complete 180. It used to be all about the product, just handing over a drug. But now, it's all about you, the patient. The focus isn't just on the box of pills anymore. It's on your history, your symptoms, and finding what's going to be the absolute safest solution for your specific situation.
So, to make this happen, pharmacists aren't just winging it. Nope, they follow a really specific, highly structured roadmap to guide every single clinical decision they make. It's all designed to make sure you get the best possible care. And here's what it's called. It's the Pharmacist-Patient Care Process, or, PCP for short. This is the official, systematic, 5-step method they use every single time. Think of it like a quality control system for your health. It ensures every piece of advice is based on solid evidence and is, above all else, safe for you.
And what's at the absolute heart of this whole thing? It's simple. It's you. You, the patient, are literally at the center of this entire process. Everything revolves around clear communication with you, collaborating with your other doctors, and carefully documenting everything to create a complete picture. It all comes back to you.
Okay, so what does this roadmap actually look like in practice? Well, you can think of it as a 5-step safety check that takes your pharmacist all the way from your first question to a safe and effective plan.
These are the 5 steps. It goes collect, assess, plan, implement, and follow up. Every single one is a critical checkpoint on the path to making the right call for your health. So let's break down what each one really means.
It all kicks off with collect. This is basically the detective phase. Your pharmacist starts asking all these questions to get the full story. Who is this medicine for? What are the exact symptoms? What have you already tried? Every little bit of information they gather is a vital clue.
Next up is assess. And this is where the real clinical thinking kicks in. The pharmacist takes all those clues they just collected and starts putting the puzzle together. They're connecting the dots, figuring out how serious the problem is, and asking themselves, could this just be a side effect from another drug, or does this point to something way more serious?
So, based on that entire assessment, your pharmacist comes up with a plan. And here's the part that I think surprises most people. There are actually 4 different ways this could go.
And this right here busts a huge myth. We think a pharmacist is just there to recommend a product, right? But selling you something is only one of 4 possible outcomes. The safest plan might be for them to say, you need to see a doctor now, or maybe it's recommending simple things you can do at home. And sometimes, honestly, the best advice is just reassuring you that you're okay and don't need any treatment at all. And finally, we've got implement and follow up. I mean, a plan's pretty useless if it's not put into action correctly, right? So the pharmacist implements the plan by giving you clear instructions, educating you on what to expect, and, this is key, telling you exactly when you should get more help. But the care doesn't stop there. They also set up a plan to follow up, to monitor how you're doing and make sure the plan is working safely.
Now, let's zoom in on what is maybe the most critical part of this entire process, and that's the decision that determines whether you should be treating yourself at all.
This is the fundamental question a pharmacist has to answer before they do anything else. Their number one job, their primary responsibility is to spot those situations where trying to treat it yourself isn't just ineffective, it could be downright dangerous. They're a crucial safety gatekeeper in our healthcare system.
So, how do they do this? They're trained to look for very specific red flags. You can think of these as alarm bells, signs or symptoms that immediately mean, whoa, hold on, self-care is off the table here. You need a more urgent medical evaluation. And this table shows you exactly why that check is so important. A severe headache, described as the worst ever, isn't just a headache. It's a potential red flag for a stroke.
A fever in a baby under 6 months old could be meningitis. This red flag check is a vital, potentially life-saving assessment that happens in seconds when you talk to your pharmacist.
So, knowing all this, how can you help your pharmacist help you? Well, you can actually become an active partner in this whole process just by preparing a little for the conversation. There are simple memory tools, mnemonics, that can help you get your thoughts organized. Using one of these helps you provide all that key information your pharmacist needs to do that collect step quickly and, most importantly, accurately.
One of the most popular ones is called Scholar Mac. Now, it sounds a little complicated, but it's really not. Before you even go to the pharmacy, just run through it in your head. S is for symptoms, H is for the history of the problem, O is for onset, when it started. And MAC is even easier. What other medications, allergies, or conditions do you have? Having these answers ready makes the whole thing so much smoother and safer for everyone.
And that really sums it all up, doesn't it? The pharmacist's patient care process. It totally transforms the pharmacy. It's no longer just a store. It becomes this vital healthcare hub. And the best part is, you are right there, smack in the center of it all.
So here's the bottom line. Your pharmacist has an expert process, a system designed to keep you safe. They are ready and waiting to be your guide through all that confusion. The only question left is, are you using them?